Good morning to all of you, to Abdiel, and to everyone who continues to listen to our program despite the time we've been broadcasting. Good morning. Today we have favorable results, which encourages us to comply with what we have achieved so far, despite the fact that not everyone is at the same pace. In our hospitals, we have today 221 COVID patients. 13 are under medical supervision, 140 are suspects, and 68 are confirmed cases. We're talking about the active cases, which represents a lower figure than the one reached yesterday. In our primary healthcare system, our professionals and specialists follow 254 people. Yesterday, we managed to process more than 3,000 samples. By the molecular biology laboratories, we analyzed 3,329 samples, a satisfying figure since we intend to increase the number in order to detect the asymptomatic positive cases in the community. These samples were studied at the Molecular Biology Laboratory of Tropical Medicine Institute Pedro Coury, 1,448, which has maintained a high rate of analysis, as well Provincial Center of Hygiene, Epidemiology and Microbiology of Havana, with 468, in Villa Clara, 439, Santiago de Cuba, 283, Hermanos Amejeiras Hospital, 368 processed samples, at the Genetic Engineering and Biotechnology Center Lab, 246, and in the Laboratory of the Civil Defense, 77 samples. As a result of the analysis of these 3,229 samples, 4 patients have been diagnosed with SARS-CoV-2 and the COVID-19. Thus, Cuba accumulates 211,427 samples studied, and 2,432 people have tested positive. This represents 1.2% of all samples studied. Yesterday, as usual, we analyzed the highest number of samples in Havana province, 2,592, but also 164 were processed in Artemisa, in Mayabeque 73, in Pinar del Río 74, in Las Tunas 113, the special municipality of the Isle of Youth processed 115, and Granma 62 samples. This information indicates that the maintained behavior in the rate of contagions with no confirmed cases in these cities for 15 days does not imply the decrease of laboratory examinations. We keep the proper established monitoring when needed. The 4 cases confirmed yesterday are Cuban. All of them are confirmed case contacts. This is a significant risk group, and ever since the pandemic reached our country, with the first confirmed cases in March, 2,101 patients have been confirmed case contacts, 88.3%. We maintain the figure of 168 people whose sources of infection is abroad, and we keep on working to determine the source of infection of 111 confirmed cases. Of the 4 positive cases, 1 is a female and 3 are male, which keep a balance. 49.5% female and 50.4% male. The 4 cases are symptomatic, something unusual. In any case, the figure of asymptomatic cases at the moment of the analysis is 1,328, which represents 54.6%. And in the last 15 days, 54.6% of all cases, the 81.7% did not represent any symptoms at the moment of the test, which is very important to control the situation, since it is possible the transmission of the disease in asymptomatic patients. The 4 cases are from 40 to 60 years of age. Still, 276 cases have been under the age of 20, of which 262, practically 95% of them, have been discharged. What demonstrates the effort and the follow-up of the Cuban protocols towards this group of patients that also takes something from the rest of the world, which has allowed a favorable evolution in each case. The 4 cases belong to Havana province, Habana del Este, Centro Habana, and Cotorro municipalities. I would like to present a chart that I asked Lillian to show Havana's sanitary situation, since each municipality is divided just by a street, which facilitates the spread of the disease. However, there are two important focuses of infection. The upper part includes Centro Habana, Cerro, and isolated cases in 10 de Octubre, Habana Vieja. But the highest number of infection is in Centro Habana and Cerro, which may be seen as an area of influence. The other area is the one that includes Cotorro, Cuatro Caminos, and isolated cases in Managua. We would like to ask all these people not to be confident with the disease, since they are in constant movement. Therefore, it's of a paramount importance to comply with all the established protection measures. Thus, Havana maintains the highest rate of infection in Cuba, with 3.89%, although it decreases every day. What proves the good work that's been done by the provincial and municipal defense councils. Mayabeque comes in second place with 0.78%, with one confirmed case in the last 15 days in San Jose de las Lajas municipality. Cuba has an incidence rate of 0.77%, which are confirmed cases per 100,000 inhabitants, an inferior figure to the one showed yesterday. This way, of the 2,432 diagnosed patients in Cuba, 68 of them are still active and under vigilance, but represents 2.7% of all cases. 67% stable clinical evolution, and as we have previously mentioned, there is one patient in serious condition from Havana in Salvador Allende Hospital. We always regret the 87 people who have died in our country due to the disease. Not new fatalities for today, but fills us with satisfaction to be able to acknowledge the good results achieved so far. Cuba has a lethality rate of 3.57%, and thus occupies the 21st place among the countries of the region and the 104th position in the world. We always mention the two patients that were properly evacuated to their country at the beginning of the disease, and also as a favorable indicator, 7 patients were discharged yesterday, 6 of them from Havana and 1 from Mayabeque. So we accumulate 2,275 discharged patients. 93.6% have been recovered. As I mentioned, we have 1 patient in serious conditions, and for the 18th consecutive day, we don't have any patients in critical conditions. In the world, we would like to have similar results, but unfortunately, it can be that way. The same 185 countries remained to diagnose cases of COVID-19, but we had yesterday 176,968 new cases. The total amount has already reached 12,875,963 confirmed cases. But more alarming, 3,704 people died yesterday in the world due to the disease, for a cumulative of 568,600 deaths, with a lethality rate of 4.41%. The region of the Americas reports 52.72% of worldwide confirmed cases and accumulates 6,788,311 confirmed cases. 1,300 2014 new cases. Yesterday, 1,963 people died in our region for a cumulative of 288,759 deaths. This represents a 4.25% lethality for the region. In the list of countries with the most confirmed cases, the United States is in the first place, followed by Brazil, India, Russia, Peru, Chile, and Mexico, being the most affected countries by the disease. This is the information we had on the behavior of the pandemic that, as has been illustrated, a proper control of the disease has not yet been set in the world, and this represents one of the most significant risks in the current year.